I would like to show my respects and acknowledge the Bedagal people, who are the traditional custodians of the land of elders past and present from which I am presenting today. My name is Tom Santo Jr., and I'm a PhD candidate at NDARC UNSW Sydney. I'll be presenting the results today of a systematic review and meta-analysis on the prevalence of childhood maltreatment among people with opioid use disorder. Here is our disclosure of interest statement. Opioid use disorder is a global health concern, and one risk factor includes the history of childhood maltreatment. Childhood maltreatment is the experience of abuse or neglect during childhood and may be a single episode or chronic. Childhood maltreatment increases the risk of adverse health and social outcomes, including those related to opioid use and use disorder. There have been reviews in community samples, however, there has not yet been a review among people with opioid use disorder. The aim of the current review was to estimate the prevalence of childhood maltreatment by each form among people with opioid use disorder. We also wanted to examine factors associated with variance and compare the estimates from the current review to a series of estimates by Stoltenberg et al. From community samples, which are similar to the general population. The aim of our search strategy was to identify every study of people with opioid use disorder that assessed any form of childhood maltreatment. We pooled estimates separately for each childhood maltreatment type and stratified results for sexual abuse by sex due to differences noted in general population samples. Random effects meta-analyses were used to pool results. We included 62 studies and over 21,000 estimates in our primary analysis. Most studies were from North America and utilized data from people receiving OAT for illicit opioid use disorder. Women and people with a history of injecting drug use reported higher estimates, as well as those that used gold standard definitions. Presented on this slide are prevalence estimates from the current review in orange, compared to community sample estimates in blue. For all forms of childhood maltreatment, excluding emotional abuse, the prevalence of childhood maltreatment was significantly higher among people with opioid use disorder. In conclusion, the experiences of abuse and neglect during childhood are very common for people with opioid use disorder. This provides further support for the evidence that childhood maltreatment is a risk factor for opioid use disorder and reinforces the need for trauma-informed interventions for this population, particularly for women and people with a history of injecting drug use. Future research should consider the impact of childhood maltreatment and those experiences on opioid use disorder, and treatment providers and clinicians may consider the impact of these experiences when an individual's opioid use and course of opioid use disorder and comorbid mental disorders. Research in the future should also consider the use of gold standard or validated definitions when assessing childhood maltreatment is appropriate. Here are our references.